First of all, I'd like to thank all of you for participating in our Town Hall meeting this evening. I'm Family Court Judge Bob Fregali, and on behalf of the Marion County Opiate Task Force, would like to welcome you all to this meeting. The task force was created and held its first meeting in June 2011 and established two of our primary goals as community awareness and education. This is the purpose for our meeting tonight. Our panel this evening is comprised of law enforcement, mental health treatment, recovery, and families. Jim Ryan will be our facilitator. I'm not going to try and impress you with statistics on the severity of the problem in our community. It's not coming, it's here. I never thought I would see the day that heroin was the drug of choice in my community. Every day, each judge in this county handles cases involving drug addiction and drug abuse issues. When was the last time you looked in our local paper and didn't see a front page article or significant headline dealing with some local drug-related activity or crime? Last year, 16 people died of drug overdoses in Marion County, and none of us are immune from the effects of this problem. I hope your family never has to deal with the loss of a loved one or family member battling addiction, or come home to find your house has been burglarized or your property stolen to support someone's drug habit. We've all heard how the state has saved money by reducing adult and juvenile prison populations. In addition, legislation has taken away judges' abilities to incarcerate offenders for low-level felony drug offenses. What this means is that our community must come up with treatment programs for these individuals while the state at the same time continues to reduce our local funding. Our governor has proposed an expansion of Medicaid, which will significantly increase funding for drug abuse and mental health services desperately needed in our community. We believe these increased funds is best left to communities like ours to expand the great programs which already exist in Marion that have been severely handicapped by the loss of state funds. I urge all of you to contact your state representatives and senator and voice your opinion on the governor's initiative. I hope all of you leave here this evening with a better understanding of our problem and take every opportunity to spread the word so we can keep Marion a safe and welcoming community to live and raise our families. Thanks again for coming, and I'll turn the evening over to Jim to introduce our panel and open the discussion.
Welcome, folks, and thank you for taking time out of your evening to spend an hour and a half with us to talk about this very, very important issue within the Marion community and all over Ohio and actually across the United States. My name is Jim Ryan, and I will be the moderator for the panel tonight. I'm an Ohio Certified Prevention Specialist, which means that I do alcohol, tobacco, and other drug abuse prevention work, try to help folks from ever developing addiction in the first place. And I will not only be moderating the panel, but I will also be sharing some prevention tips and pointers throughout the evening tonight as well. As the judge mentioned, I think it's very important for us to recognize and thank our sponsors tonight. When we look at pulling something like this together and having this many people here, it takes the work of a lot of folks. So I'd like to appreciate the Marion County Opiate Task Force, the Marion Crawford Adam Board, and the Marion Crawford Prevention Program. So thank you all for organizing this tonight. Before I introduce our panelists, I want to give you an idea of how things are going to flow tonight. The first thing I want to let you know is we are not going to solve the opiate epidemic by 8 o'clock. That's a high task. So I want us to keep our expectations around the idea of getting some good education, some good information, and some good awareness, and walking away with some tips and some ideas on how each of us can play a role in addressing this issue, whether that's preventing the problem in the first place, whether that's lending support to folks who are in recovery, whether that's encouraging more treatment services, whether that's helping law enforcement address this from a law enforcement perspective. So I want you to walk away with some ideas tonight, and our panelists will give you some of those. As you noticed on your agenda, we will not be taking questions verbally tonight. We will have folks coming around with baskets with index cards and pencils. We encourage you to write down any questions you have, raise your hand, and then someone will pick up those index cards, bring them to me, and then we will facilitate the question and answer with the panelists. I would encourage you to wait until most of the panelists have spoken before you write down your questions, because they may actually answer your question before you have a chance to write it down on your card. Okay. Again, thank you for being here tonight. I'd like to introduce our panelists. At my nearest to me is Orman Hall, who is the director of the Ohio Department of Alcohol and Drug Addiction Services. Next to Director Hall is Lieutenant Chris Adkins with the Marion County Police Department. Next to Lieutenant Adkins is Will, who's a recovering addict. And next to Will is Mary Jean Hensley, who represents the family impact of this epidemic. I'm going to let Director Hall start, and each of the panelists will take a few minutes to share their perspective on this issue and some thoughts they have on it, and then we will enter into the question-answer phase. Thank you.
Well, first of all, let me say we've been doing opiate town halls around the state of Ohio, Opiates, and a number of people have been involved in this type of work for the last 2 years. And I have to say, this is an unprecedented turnout for an opiate town hall in a community this size. Which I think is a testimony to two things. It is a testimony to the magnitude of the problem that exists in this community and around our state, and it's also a testimony to the leadership that exists in this community around dealing with this problem, and I am impressed, really impressed. So, from the standpoint of introductory comments, I would like to just address the nature and the scope of this problem, at least from my perspective. I think that it's important for all of you to know that since 1997, there has been a 1,000% increase in the use of prescription opiates in Ohio's healthcare system, a 10-fold increase. So if you go back to 1997, and if you took the total number of doses that were dispensed in our state at that time and you divided it by our state's population, every single one of us would have received 6 or 7 opiate doses. Now, if you move forward to 2010, and if you take the total number of doses, divided it by our state's population, every single human being in Ohio would have received 67 doses. Which is staggering. I don't know about you, but I didn't receive 67 doses in 2010. So what we have is a situation here where our state, the environment that we're in, is literally polluted with prescription opiates. And what many people didn't realize until just recently is that prescription opiates are virtually identical to the illegal drug heroin. We have an environment that is polluted with prescription opiates, a population that was largely ill-informed about how dangerous and addictive these drugs are. So in hindsight, much of what has happened in Marion and around our state is completely predictable. So let's look at some of the statistics around what has happened. There has, during that same period, been a 400% increase in overdose deaths in our state. There are now more people dying from drug overdoses in Ohio than are dying from automobile accidents. And for the most part, the majority of those deaths are not in urban centers. They are in communities like Marion and Gallion and Delaware. So this is largely a rural and suburban problem. From a treatment standpoint, if you go back to 2001, less than 7% of those persons in treatment for an addiction disorder in the state of Ohio were there because they were addicted to prescription opiates or heroin. This year, approximately 30%, almost 30% of all persons in treatment for any addiction disorder in our state are there because they're addicted to prescription opiates and heroin. And by the way, I want to make sure that everybody realizes that, that virtually no one starts out on heroin. Most people, the vast majority of people, start out on prescription opiates, and when prescription opiates are no longer affordable or no longer obtainable, people move rather rapidly to heroin as their drug of choice. So what are the solutions? Where do we need to go? From my perspective, it boils down to two basic strategies. Number one, we have got to dramatically reduce the use of prescription opiates in the treatment of chronic pain in our state. Virtually no other society in the world uses prescription opiates for the treatment of chronic pain the way the United States does. And to give you a sense, in 2000, going back to 2010, the United States consumed 99% of the world's supply of Vicodin, about 80% of the world's supply of OxyContin, with about 4% of the world's population. We are clearly out of kilter from the standpoint of how the rest of the world views and uses these types of medications. So we have got to reduce the use of opiate medications, again, in the treatment of chronic pain, not in the treatment of acute pain or in the treatment of terminal pain, in the treatment of chronic pain. Where that has been done, there have been significant declines in the number of people that have been addicted. So if we can do that, we're going to dramatically reduce the number of new people that are being infected, and I think that's a good word to use here, infected with opiate addiction. The second thing that we need to do is we need to improve access to medication-assisted treatment. And I need to acknowledge here that, that the state of Ohio needs to do a better job of making treatment resources available to your local ADAM system, and we need to do a better job of making sure that medication assistance is available. The vast majority of people who are addicted to prescription opiates and heroin need medication-assisted treatment if they're going to get better. And right now, we don't have enough resources, and you're not generating enough local resources to provide appropriate treatment to the vast numbers of people that are addicted. What I would like to do rather quickly is to leave you with a ray of hope. One of the things that I've noticed in Fairfield County from the standpoint of looking at some of our more recent youth survey data is that youth are reporting two things. A significant reduction in the number of students who are reporting recreational use of prescription opiates, which is really important, and a significant increase in the number of students who are reporting that they believe prescription opiates to be dangerous and that they shouldn't be used for recreational purposes. So I think we could be on the verge of turning the corner from the standpoint of making sure that we have fewer people who aren't addicted becoming addicted. We still have significant and very serious problems around making sure that we provide appropriate care for those persons who are currently addicted. And with that, I think I'm going to turn the mic over to the next presenter. Thank you.
First, I want to thank everyone for coming tonight. It's a large crowd, and it gives a ray of hope to Marion by seeing everyone because we know everyone who's in this building cares. And I'll start off my name is Chris Atkins. I'm a lieutenant with the Marion City Police Department. I'm currently assigned to the Marmet Drug Task Force, which most of you have probably seen in the paper lately, or at least have an idea what it is. But I wanted to take a second to go over what Marmet is. Marmet is a member of Metrich, which is a 10-county drug task force for our region. We are made up of city police officers, sheriff's deputies from the Marion County Sheriff's Office, and Marion County Prosecutor Brent Yeager is also a member of the Marmet Drug Task Force. We are a self-funded drug task force where we survive on the funds that we get from drug dealers and the items that we take from them from their profits of selling drugs. The only thing that citizens provide as far as that is they provide the manpower from each department. And obviously what's been in the paper for the last year and a half or so is the massive cuts that public service as well as all the things to deal with treatment have taken. And that hurt last year. That hurt substantially to Marion County. And many of you don't know, we're going to go over some stuff today, but Chief Bell and Sheriff Tim Bailey stepped up to the plate a couple months ago and decided to take extra units off the street to put more emphasis on the drugs in Marion. We know we had a drug problem. We knew we had to address it. And we realized that everything trickles down from a drug problem to your thefts, to your burglaries, to your robberies, as you've all seen in the paper. So if we figure we can hit the drug problem, maybe we can alleviate some problems on the street and some problems to the citizens from getting their cars and stuff, so forth, broken into. I was asked to speak about some of the signs of drug activity today. I'm not going to speak a whole lot on the users because there's a lot of professionals up here that can take care of that. Like many cities throughout the United States, Marion is facing a growing battle against drugs. Police can't solve this problem alone. Success requires community involvement. It is important to know that the investigation, what is in an investigation and how you can help. It is often hard to be certain about what you are seeing and making sure that what you're seeing is actual drug activity. Is there an unusual amount of traffic coming and going from the house, finding drugs or drug paraphernalia, syringes, pipes, baggies and so forth in your neighborhood or in your lawn. Repeated observations of exchange of items out in front of your house and in your neighborhood or at the corner. Odors can give away to some meth labs. Houses or buildings with extreme security measures. We all know that some people's got security systems on their house, but when they overdo it, you got to ask yourself why. Houses or buildings where no owners or primary renter is apparent. We have a few of those. How to report drug activity. And a lot of the things I'm going over today, I have sheets. Obviously, I didn't bring enough sheets, but a lot of these have tips on what to call in, how you can help the Marion Police Department, the Marion County Sheriff's Office. Don't assume that police already know about the drug activity that's in your neighborhood. Don't assume that someone else will call. That's the big thing. Keep on calling, keep on reporting it. Report changes, report anything that you see in your neighborhood that's not right. Many of you have lived in your neighborhood for a long period of time. You know if something seems out of place. I have numbers in here for the City Police Department and the Marion County Sheriff's Office. One thing I'm here today to promote is the TIPS line. Many of you have seen it. It's a pretty easy number, 375 TIPS. That has an answering machine and there's no caller ID, so don't be afraid to call that number. I want to talk about a few things that we have problems with as far as the TIPS lines go, and maybe try to help get the word out there. The TIPS line is not for anything that's in progress. What I mean in progress is if someone's being assaulted or there's a drug deal going down in progress, you need to call the local police department for either the sheriff's office or the police department. Drug activity, which police need to be aware of but do not need to respond to immediately, would be the TIPS line. It can be left at the 375 TIPS number. And anything that is needed right away, then you call your local police department. What the police would like to know when you call. The more information you give, the better it is for us, especially the guys who work in the drug unit. What makes you think drugs are being sold? Which drugs are involved? How long has the activity gone on? Have you reported the activity before? What is the address of the suspected drug activity? Is it a building, single home, apartment? Where on the property is the drug activity taking place, front door, back door? You all know this in your neighborhoods. You've seen where they come and go from. The vehicles that are coming and going. Do you know the address, or do you know the owner of the property? Do you know the names of the persons who are suspected of dealing? We can go on and on. They're all on here. Any dogs, any way that you know if the house is fortified. This is all information that helps the drug task force and their investigation. A lot of people wonder what happens after you make a report. When you make a report of drug activity, an officer will respond as soon as possible or available. And that's for both departments. However, drug transactions seldom involve any dangers to either participant or bystanders, and crimes that endanger someone must have first priority, such as domestic violence and some of the other calls that come in. Also, drug deals are they're over with fairly quickly, so by the time you make that phone call and get on your way, it's usually done and over with and they're out of the area. Citizens reports. We get a lot of calls that says, I called and told you a drug deal happened, why didn't you arrest them? That would be nice, but we'd be in front of the judges a lot more. We have to have probable cause to make an arrest. We have to have specialized training to do what we do. So when you do call, we do care, we do listen to those, we do work those. One thing I wanted to go over is a huge thing. Just because you don't see an officer in your neighborhood that you see doesn't mean one's not there. And that's very important. When people call, I didn't see a cruiser go down there. Well, it may not be a cruiser, it may be an undercover detective. And that's the reason why we had the Marmet Drug Task Force. We do have neighborhood watches. The Sheriff's Office has one. The City Police Department also has neighborhood watch groups. I would get involved in those. I know the city has several, and I believe the county has a few of them also. They help. Know who's in your neighborhood, know what is going on with your neighbors. You can watch each other's houses, and then if someone does move into the neighborhood you're not familiar with, it kind of lets them know that you have a neighborhood watch group going on, and that you want to make sure they know they're not doing anything illegal. One thing before we leave, I kind of wanted to go over a couple numbers with you. This was discussed at council last night, and I'll make it real brief. This kind of gives you an idea. 2 months ago, we added a few people to Marmet. In 2 months, we've put together 42 cases for drug trafficking in Marion County. And that's in 2 months. 38 possession cases, 142 grams of heroin has been seized, 54 grams of crack, 500 plus pharmaceutical drugs, and over $40,000 in cash taken from suspected drug dealers. That's just in Marion in 2 months. And then just this 2 month period, our first quarter, we have met or exceeded what we generally do in 1 year's time in Marion County. So prior to me passing it on to Will next year, if I have tip line cards if you need them, and I also have this form with a lot of tips of the information that the police need. And if anyone would want one, let me know. Marmite also does educational things as far as bringing the drugs out, letting you see them, so you know what you're dealing with. If you have a group or organization that would like that done, you can contact us. Thank you.
How you guys doing? My name is Will. I'm a grateful recovering drug addict. And I say grateful recovering, or I say grateful for it because, being a drug addict and working a 12-step program has actually made me into the man I am today. I'm going to pretty much tell you how I realized I became an addict and then what I'm doing today to stay clean. I'm going to give you the perspective from a drug addict's point of view. Back when I was younger, middle school, high school, I liked to experiment with pot and alcohol. Didn't think it was a big deal. As I got older, I realized that addiction is actually a disease, and it's chronic, Left untreated, it's just going to get worse. By the time I was in high school, I started off with prescription painkillers. And then, like they said, it just gets too expensive, and heroin is everywhere. It's everywhere, not just in Marion. It's all over the country. It's everywhere. The first time I tried it, I used IVs. I was instantly hooked. I thought I found the love of my life, and it was in a drug. I will say, jails, institutions, and overdoses is all part of my story. And active addiction, I used to be scared to death of guys like this. You wouldn't find me near them, But, as I started using heroin, one night I overdosed. I had to go to the hospital, and I was charged for possession of heroin. A judge in Delaware County gave me a chance, and I was so caught up in addiction I couldn't stop. So I kept using, and I didn't care. I didn't know how to get clean. So eventually I was sentenced to prison, first time ever going to jail, over a drug overdose. That was a big wake-up call for me. The overdoses, I didn't care. I didn't care about death. I was a drug addict, and that's how we think. We think, we're so selfish and we're so self-centered. We don't care what anybody else thinks. We don't think anybody cares for us. But when I went there, that was a huge wake-up call for me. That's not who my family raised. Not a heroin addict. I wasn't. Someone would have told me when I tried alcohol and pot in like 6th grade, if you're going to be a heroin addict, you think I would believe them? No. Everything just gets worse, and I'm a living example. By the grace of God, I'm still living. I should have been dead on countless times. I got introduced to a 12-step program when I was like 15 years old. I'm 23 now. And I didn't think I was an addict because I wasn't using heroin, cocaine. I was just using the so-called small stuff, alcohol and pot is what they call it, but no one knows that it gets worse. Like I said, it's a progressive and fatal disease, and it will kill you, or you will end up in prison, or, like I said, jails, institutions, and death. And, I just got out of prison in November, and ever since I've been out, I attend 12-step meetings once a day, twice a day, you know, and so I didn't believe that there was anybody out there like me, you know? Like, I used to run and hide from all my feelings. I had no idea that there was other people like me. But by working these programs, it's truly saving my life, and I'm a lot more open-minded now. You know, as a drug addict, I now know that I can't hang around the same people, places, and things. If I hang around my old friends, I don't care. I don't care if I know them since I was 3 years old. If they were my real friends, why would they use in front of me? Why would they let me get high? Now that I'm in like 12-step programs and stuff, none of my old using buddies even call me at all. And you realize who your true friends are. And that was real hard for me to realize, because in my neighborhood, everybody uses, you know, but I've, you know, since I've been clean, I learned how to feel feelings and deal with them. You know, I've had a lot of friends overdose. Do I got to go get high over it anymore? No. You know what I mean? You know, I got a sponsor in the 12-step program who's his sponsor got to sponsor. I'm sure his sponsor got to sponsor, so it goes a long way. When I came here tonight, I wasn't really sure what I was going to say. I wasn't really sure there was going to be like 5 million people here either. So like, I've been like a nervous wreck, and I see everybody else has like little things to say, and I'm like up here with nothing. But it was suggested that I should put something down on a cue card and maybe go off of that. But, you know, I decided I'm just going to speak from the heart and tell everybody what it's like as a drug addict. You know, as a drug addict, once the pain becomes enough that you can't handle it, you will find a way to stop. You know, my parents and everybody around me wanted me to stop so bad, and they were throwing me into rehabs and stuff like that, but I didn't want to quit. I took it as like a vacation, you know? But eventually the pain will get so bad, or you're going to end up dead or in prison, or who else knows. Like I said, you know, since I've been out, it's been about 5 months, and now, you know, my life has never been better. You know, my parents love me, for one. You know, I go to meetings every single day, and I open and share with other recovering addicts, and I kind of share a little bit of my story, because maybe I can touch a kid's life who's going down the same path as me, you know? And like I just said, I got out 5 months ago, and I had the honor to go back into prisons and kind of tell my story. And they're always like, man, why you come back for a 12-step meeting? You just got out. And I'm like, to show you guys that, you know, I am living proof that you guys can get out and do the next right thing and be able to live your life as a normal human being. Okay. I kind of froze when you guys all started clapping and stuff, you know what I mean? I was like, okay, I'm done, but maybe I'm not, I don't know. But I will say this, you know, now that I'm clean and I see all these people out here that care, you know, in active addiction, the using addict ain't gonna know none of you people care, but you guys do. And Marion, you guys are stepping up to the plate hardcore and cracking down. I give you guys props for that. But if you are an addict out there and you want a new way to live and you want to give yourself a break without living in prison inside your own head, try to do a 12-step program and do what is suggested to you. You know, you gotta surrender and admit that you're powerless over drugs and alcohol. Otherwise, you're gonna be stuck in the same old path of destruction. I don't really know what else to say, but I'd like to, yeah, I should have wrote a cue card, but I'd like to thank, I just want to thank all you guys for just allowing me to share. Like, I am not a public speaking person. I am so nervous right now. Like, I'm almost done and I'm so nervous, but you know what, like, it feels great. You know, I've realized that I do have a higher power, and he wouldn't give me anything that I can't handle. And with that, I'd like to thank you guys.
5 years ago, a journey began for me that has taken many twists and turns. I have met many amazing people in places I never thought I would be, treatment facilities, courtrooms, and jails, but also in places such as this, with people who are ready to extend a hand and a heart to help me. The Adam H. Board, the Opiate Task Force, Victory and Truth Ministries, our Alpha Recovery Program in Crawford County, and Together We Hurt, Together We Heal. You see, 5 years ago, my son told me, with a tear streaming down his face, that he was addicted to heroin. My first response was, well, quit. I knew very little about heroin or about addiction, obviously. I had no clue heroin was in our area, let alone in my home, and how quietly and savagely it was ripping apart our community. Google became my best friend. Oh, if I just knew then what I know now. The pain and fear was at times paralyzing, and I knew one thing for sure: I didn't want others to feel this way. I learned words like triggers, relapse, detox, rehabs, Suboxone, methadone, the nod, falling out, the rush, overdose. That word stopped me in my tracks. My child could die from this? So I started calling treatment facilities. The first treatment facility that I called said that it was going to be $20,000 for 3 months. There was dead silence on my end of the phone. She said, well, you can refinance your house. You do that for a boat or a vacation, right? She said, or you could wait and refinance your home if you don't get him treatment to pay for his funeral. I was stunned and scared to death. How did we get here? Did I believe that my son Ben was drinking and smoking some pot? Yeah. Naively, no, but realistically, yes. Had we talked about it? Yeah. Did he say he would stop? Yeah, he did. Was I aware I could buy a drug test to see for sure? No, I had no idea. But I would strongly suggest to you parents to test your children from preteens on up if you suspect anything. The tests don't lie, but your children will. And if they say they only did it once, I'm sorry, but they're probably lying about that as well. Some parents I know are checking their kids or testing their kids just to keep them in check. Might we make them mad? Yep. But we might also save them from going down a very dark, scary road of moving on to harder drugs, which in turn will save their life. My son has spent almost 2 years in jail and treatment facilities. He has incurred $1,200 in fines and lost the trust and respect of his family for quite some time. It is easy for family members to throw their hands up and be done, not because we don't love any longer, but because the lies just become too much. I recently ran across a quote that I think has been very fitting. The worst thing is watching someone drown and not being able to convince them to stand up and save themselves because they are just standing in water. I tried begging and crying, but that didn't work. Whether it is the beast inside or the monkey on the back, addiction has the power to wipe out reason, willpower, and good intentions. My son must have said 100 times, "Mom, I'm good. Mom, I'll quit." And I really believe that he thought those things were true. Addiction creates a perverted reality within the addict's mind in which obsession with the drug completely incapacitates any rational thought. This condition isn't a figment of their imagination. The addict will crave the drug because it has taken over that focal point in their life and nothing else matters. Let me back up just a moment, though. It's really hard sometimes to tell whether or not a person is using heroin. You really have to look for the things. Look for changes in behavior as a key part of their heroin addiction symptoms. They may spend more time alone than before or not interact with family and friends. They may lose interest in their job, their education, their hobbies, and this may be a slow process, so these symptoms may not be too dramatic. They may have some physical signs such as dry mouth, shortness of breath, or a general slowing down of their actions. If they're wearing long sleeves in the weather, when the weather is warm, or when they are sweating, they're hiding their track marks. Their behavior might be strange, or perhaps they just fall asleep for no particular reason. That's the nod. Their pupils become constricted, and they may not know where they are or what's going on. Heroin users have to prepare the drug for injection, which for many is the most common way of use. My son was shooting, or banging as some call it, 15 to 20 balloons a day. He got to the point that he had blown out his veins and said he felt like a pincushion. Some have to prepare their syringe before going to sleep at night because when they wake up, the dope sickness will have set in and they will need to use right away. Be on the lookout for paraphernalia, such as syringes, a spoon, which is used to cook the drug, aluminum foil, or a plastic bag or small balloon with a white or brown substance in it that to me smells like vinegar. You may find cigarette filters, little pieces of balloon, water bottles. They hide stuff under mattresses and video game cases, shoes, pockets of clothes that they don't wear often, under dresser drawers. Look in the bathroom too, on top or beneath cabinets and in the tank of the toilet. They might have straws that have been burned. Maybe there is a water pipe. Look for clues as part of your search for heroin addiction symptoms. If there is no physical evidence, then look for behavioral evidence. As the disease progresses and becomes increasingly more important to the addict, they will change. They will lie and cheat to get their drug. They will steal money and objects from their family and their friends. They will avoid making eye contact with you. They will sleep more, sometimes all day. Every activity of their life will begin to slip away. Their closest friends will be replaced by the acquaintances they do drugs with. They'll avoid family, and they will eventually lose their job or possibly even flunk out of school. For those of you who have those under the age of 18, this is crucial that you watch for these things because that's when we, as parents, can still do something. Once they hit 18, it's out of our hands. Addicts no longer care about what they look like or their personal cleanliness. These are key giveaway heroin addiction symptoms. They are likely to become irritable and sometimes aggressive or nasty to people who would otherwise love to be around them and they would want to be around. As the disease takes over, they no longer have self-respect. The disease of heroin addiction has an arrogance as it takes an otherwise rational person and turns him or her into a completely selfish, uncaring, and destructive person. Because the addict will build up a tolerance to the drug, it is going to take more and more heroin to achieve the effect. As the drug takes over, they may lose interest in eating and lose a lot of weight. The injections can also lead to using dirty needles, which can lead to hepatitis and HIV and AIDS. They may even get an abscess that will land them in the hospital. Family and friends can play a major role in watching for these heroin addiction symptoms by simply watching the person that they love. Look for the signs, not just the dramatic signs of addiction, but for the subtle changes in behavior. The sooner you see what is going on and step in to help, the better. I know some of these signs sound like typical teenage behavior. Know your child, know who they hang around with, and talk to them about drugs and addiction. Don't expect them to know this stuff, and don't expect someone else to do it for you, because there is a drug dealer waiting to pounce on your children. Don't be afraid of the conversation of drugs and addiction. Be afraid of what can happen not having that conversation. Relapse on average can happen 7 to 9 times. I'm, for the most part, okay with relapse because it's better than the alternative, which could be death. Relapse is not a failure. It is a proof they need to learn more to stay sober. Addicts are not bad people trying to get better. They are sick people trying to get well. Treatment, in my eyes, is a must. A 12 to 16-month program is excellent. I believe there are many reasons an addict is resistant to treatment. First off, they know they will be dope sick, and that is like the worst flu that you have ever felt in your life. To go away from their home for such a long time is scary, but I think most times it is due to the impaired ability to process information. They can think of one thing and only one thing, and that is getting high. Please bear with me. As I said, these are things that I wish that I would have known 5 years ago. It is true that drug addiction damages the chemical electrical circulatory system of the brain, which affects decision making. The brain's reward system is short-circuited and no longer produces dopamine. The dopamine is no longer needed because the opiates are doing the brain's job. Resetting the brain system has to take place when the substance is gone. I'm told that that can take up to 2 years for the receptors in the brain to heal. Fear is common in early recovery. It is a big part of addiction itself. Addicts don't escape into substance abuse because they are good at facing things. They are unable to cope but know how to ease the pain. They experience grief from themselves and from family members from trying to get sober and failing. Guilt and shame of all they have done to themselves and family haunts them and often drives them back to numbing the pain. I am pleased to say that my son has been in recovery for 16 months. He is using a medically assisted treatment program that Mr. Hall spoke of earlier, Suboxone. He has completed the Alpha 12-step recovery program, is active in church, works full-time, takes online classes, and is oh so nice to be around now. Some people say if he is on Suboxone that he is switching one drug for another. I will lovingly tell you that I'm okay with that because he will never overdose on this because he's using it as it is intended. He is not sticking a needle in his arm or other parts of his body 15 times a day, and he will tell you that without God in his life, he won't make it. The group Together We Hurt, Together We Heal, which myself and 2 other mothers of sons addicted to opiates and 2 pastors formed, is very active in support, education, and intervention in Crawford County. We are a 501c3, have our bylaws and our code of regulations. We have held 2 fundraising banquets in an attempt to open up a transition center, but have been met with much opposition. We are sitting on over $50,000 till we find a place, and we will. Our banquet this year is September 10th at Dillinger's in Bucyrus. This past year, we were able to support a young woman in sober living who is now 8 months drug-free, working, living on her own, and regaining her respect and love of her children and her family. We have held 2 community care marches, attended the first year in Bucyrus by 1,500 people, and this year in Gallion by a couple of hundred. All who see the need and many who were hurting. This year we will be in Crestline on November 2nd and hope to see you there. We all showed up to unite to declare that doing nothing is not an option. We joined hands and hearts to pray for all the lives touched with addiction. We have declared from the start that we believe Jesus is the answer to this problem. Together We Hurt, Together We Heal partners with the Alpha 12-Step Recovery Program on Sundays to help families heal and learn how they can help their loved one. We are enablers and codependents and need to learn how to think differently as well. We need to know we didn't cause this and we can't cure it. They say that an addict will always be an addict, but a user, I don't think so. There is hope and healing and recovery is possible. I have always said, don't mess with my babies. If there is a bully bothering your kids, you will step in if you see that harm is going to come to the one you love. Heroin is that bully on the corner, and it is time for all of us to step up and save our communities.